In the first few years of life, the quality of a child's experience provides either strong or weak foundations for learning, health and behavior throughout life. As critical as this phase is for development and survival, there has been no approach to screen children to identify health conditions warranting medical attention and ensure early intervention. Out of every 100 born in this country annually, 6 to 7 babies are born with a birth defect. To address this issue, the Ministry of Health and Family Welfare, Government of India, under the aegis of the National Health Mission, launched Rashtriya Bal Swasthya Karyakram, commonly referred to as Child Health Screening and Early Intervention Services.
In our center, that is District Early Intervention Center, has done a tremendous job and so much of benefits to our children who come to us, these children from birth till 18 years of age. As we say, these children who have defects at birth. Some of these children who have so much problem because of the congenital heart disease. If we leave them, we know that these children will keep on getting chest infection, cough, they'll not be able to gain weight or to gain their height. But you know, at the early intervention, that is the surgery that we've sent from here, from our center to other higher centers. We have MOU signed with centers like Apollo Hospital Chennai, Apollo Hospital Guwahati, and also Amrita Institute of Medical Sciences in Kochi. So because of the early intervention, these children after surgery, when they come back to us, you can see them, you know, they're able to gain weight, they're able to go back to school. So this is one of the examples of these defects at birth, where when we do early intervention, it changes the life of a child and also of the family as a whole.
Ingkong amtip bidon ke jipang had hadin bangalawan ban eye injection of organized hospital masih obante bidon ke jipang had but denang ni bakisapha bandet banle ka surgery hapo Apollo Hospital ling baka jingarap sang ka sarkar bat ngaklam da don kamru banlut pisak ndiat ru na do bangalej hado bangan lawan phai bat nga ai play ru bat nga sumu ya ka sarkar bakalakloi banyarap bat kumtru ya ka RBSK program kapala ai ka yangi na takani
RBSK aims at early detection and management of the 4 Ds prevalent in children through trained and dedicated mobile health teams. The 4 Ds are defects at birth, diseases in children, deficiency conditions and developmental delays including disabilities. The services aim to cover all children of 0 to 18 years of age group in 3 different categories. 1. Birth to 6 weeks. Screening of newborns at public institutions and home by medical officers at delivery points or ASHA through home-based newborn care. 2. 6 weeks to 6 years. Screening of preschool children in Anganwadi centers in both rural and urban by designated mobile health team. 3. 6 years to 18 years. Screening of children enrolled in classes 1 to 12 in government and government-aided schools by designated mobile health team MHT.
Pagkateng jonga kade subhania renja ini ide kunjanga Vanessa renja de lingba kani ka DIC niyo ban sumaria ini kunjanga lingba kani de ikunjanga ipang klong snam niyo ban sumar hapo Apollo Hospital tenga kwa ban ai kublei yaki doctor but yaki batre hani hapo DIC.
The Meghalaya government under Honorable CM Shri Conrad K. Sangma conceptualized an early childhood development program aimed at the overall welfare of children. Recognizing that mothers are key stakeholders in the physical, mental and emotional development of the child, the state government launched Meghalaya's first early childhood development helpline 14410 on International Women's Day on 8th of March 2022. The ECD helpline is a component of RBSK program. The aim of this call center is to 1. Support pregnant women and mothers in child nurturing and care. 2. Provide simple, effective and personalized health counseling to the pregnant woman beginning from her pregnancy stage till the child reaches 2 years of age. And 3. Provide antenatal, postnatal advice and mental health counseling related to postpartum mental health issues. The call center is equipped with specialized nurses, counselors and doctors who act as teleconsultants and make outbound calls to pregnant women and mothers.
We're very happy to see that mothers have taken the advantage of calling this toll-free helpline number in the state, 14410, and opting for childcare and mother's health support through our army of nurses and staff nurses who are located not just in this call center but also across the districts. Through the connectivity of technology and cloud-based platforms, we're able to ensure that mothers get access to help, support, nurturing conversations, meaningful interventions online through local language-based interventions that our nurses deliver through the working day from 9 a.m. to 7 p.m. Throughout the week. All they have to do is pick up their phones, dial 14410, and a nurse or a consultant or a medical practitioner who's working within our network will answer that call and ensure that support is provided through all of these networks of stakeholders, and where possible deal with the situation on the phone call itself.
The ECD and Maternal Helpline aims to support beneficiaries with personalized telecounseling during the first 1000 days of the child's life from the date of conception. Beneficiaries are able to access the helpline from Monday to Saturday, 9 a.m. to 7 p.m. by calling the toll-free health helpline 14410.
I am a senior staff nurse in the ECD helpline. We deal with mothers who are pregnant and who have delivered, and also with children below 2 years of age. So day to day we have been making inbound calls as well as outbound calls to pregnant mothers, and we have been giving them education regarding nutrition, weaning, complementary feeding, how we encourage the mother to go for institutional deliveries, the vaccines that the child needs to get. So these are the type of education that we give to the mothers.
The Health and Family Welfare Department of the Government of Meghalaya under the RBSK program also sponsors children with birth defects like cleft palate, cleft lip, etc. This is a part of the DEIC under RBSK, where screening for children is done and treatment is given at the earliest.
Ini day kunjonga, di idon kejingpat na kecentur nang ne, bat na support ru, del ada ban sumari I hawlan stal, de mental ngba kaneka RBSK scheme, ane halamali, ngilawan bat ngila pendap ya kaneka mental ka support, de mental ila biang ka bab gadi, kapan keren ru ila kamlaji, de ngasoban ai kublai ya ki doctor si ki nurse ki balai rap yangi.
The early intervention centers are established at 3 MCH hospitals across the state. The purpose of DEIC is to provide referral support to children detected with health conditions during health screening, primarily for children up to 6 years of age. This initiative by the Government of Meghalaya is greatly appreciated by the beneficiaries, thus further emboldening the government towards establishing many more early intervention centers across the state to ensure, once and for all, a safe and healthy future for a child, in order for them to seek and receive timely support in all areas that concern child nurturing and well-being of both mother and child.